Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, October 24th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. As we recognize Breast Cancer Awareness Month, Montefiore Einstein's Comprehensive Cancer Center launched a new breast care center located at 1250 Waters Place. Staffed by some of the country's leading breast cancer physicians, surgeons, and researchers, the center provides various services and resources. Nurse Practitioner for MECCC, Elaine Matos, joins me to discuss the new addition to Montefiore. Elaine, thank you so much for joining me.
Thank you for having me.
Now, can you tell us about the new breast care center at Montefiore Einstein?
Yes, we're very excited. The new Montefiore Einstein Breast Care Center is a state-of-the-art facility that offers breast screening, diagnostic testing, biopsies, and then consultations with all of our physicians. So surgery, medical oncology, radiation oncology, genetic testing, plastic surgery, all under one roof.
Now, the new center aims to enhance access and provide more timely care, which upon reading that, I was like, oh, I could imagine how helpful that is just in general for any center. How will this assist in cancer screenings, outreach, and more?
So the center is providing access to patients because, as I said, we're offering everything under one roof, and this is really shortening timelines to care for patients. So you can have a screening mammogram if there's a finding. You could potentially have your diagnostic workup and even a biopsy on the same day. You can see a surgeon on the same day if it's necessary. So this is allowing for the patients to have care and reach a diagnosis and start treatment much more quickly, which is super important when we're dealing with cancer.
Now, with a goal of reducing late stage cancers in New York, what are the benefits of having a center like this for Bronx patients? And I'm sure it's available to everyone, but I'm assuming that you'll mostly see Bronx patients.
Yeah, so it's certainly available to everyone, and we do see patients from other areas as well. This center is a completely comprehensive breast care center. So it reduces late stage cancers because we offer everything under one roof to the patient. So they can have screening, diagnostics, and treatment all at this facility.
Now, I also just like thinking about this. Can you just talk about in regards to like stress, how helpful it is to have like all of these, services and resources under one roof?
So the diagnosis in and of itself of breast cancer is very stressful to a patient. And then the number of visits that it entails from the time of diagnosis throughout treatment can be innumerable. So by offering all of these services in one place, it allows for the patient to have multiple visits in one day. So they don't have to take off as much time from work, worry about childcare, and then also move through their treatment more quickly. We also have BOLD, which is Bronx Oncology Living Daily, as a psychosocial support to the patients in the facility. And these are cancer survivors that we can pair up with patients that are of the same age, ethnicity, and they can be a buddy to the patient and meet them at visits and offer support. And they have all different programs that they offer. So it's really amazing to be able to do this.
And I'm so glad that you shared that with us because, I think initially just listening to this, you often just think about like the medical, like the body part of it, but we don't think about like the mental and how important and how useful it is just to have somebody who understands what you're going through and can like walk you through that as well. So thank you so much for sharing that. Can you just talk about like what you like most about having that available?
So as you said, we often think about just the medical piece of it and treating the cancer, but we're really treating the patient as a whole. And the diagnosis is so stressful to the patient, to their family. So BOLD does all sorts of programs, meditation, yoga, events in Spanish, events in English, where the patient really gets to speak with other survivors. And it's so helpful to see somebody on the other end of it. When you're diagnosed, you sort of feel alone. And we provide this network of support to the patients. And it's a light at the end of the tunnel to say, this is where I'll be in 5 years.
Now, can you tell us more about the on-site advanced diagnostic technology?
Yes. So as I mentioned, the Montefiore Einstein Breast Care Center is a brand new state-of-the-art facility, and that includes all new equipment. So we offer 3D mammograms, which we know research has shown is better at detecting smaller cancers, particularly in dense breast tissue, that a two-dimensional mammogram may have missed. And aside from the diagnostic piece of the new equipment, we also offer a newer level of comfort. So some of these devices offer self-compression, where a woman can compress the breast tissue with a remote on her own. And of course, this is guided by a technologist. So we make sure that the tissue is adequately compressed for appropriate viewing of the tissue. But that's a piece of mammography that is traditionally known to be very uncomfortable, the compression. So with these new devices, we're allowing the patient to do it on their own, and it's more comfortable for them.
Now, can you talk about screenings? What can people expect when they go to a screening?
So at our recent screening event, which was very successful, we sort of open our doors to the community. So the screening event is available to the uninsured, the underinsured, or patients that are insured, but perhaps just hadn't had their screening mammogram that year. So we offer a screening mammogram. All of our team is there and available to the patient so they can have a clinical breast exam. They can meet with genetic counselors if it's appropriate for them. We have members of our bold team, as I had said, that are there because sometimes just screening can be scary for patients.
Right.
So they're there to support the patients through. And then at that screening event, should there be a finding, we can set the patient up for diagnostic testing, biopsy if necessary, and should they end up with a diagnosis of breast cancer, plug them in immediately with our team to initiate care.
That's what I wanted to highlight, that it's same day test results, which I think is so crucial. Just in our day and age, like we're just used to having everything fast. And I know that sometimes having to wait a week or anything longer can really like build anxiety for
Absolutely.
so many people. So it's really great to hear that it's same day test results. And I can imagine this is very beneficial for people from underserved populations. Can you just expand on how it could be beneficial to them?
Yeah, so I mean, having access to screening mammograms, many people take for granted, but for an underserved patient population or for someone that's not insured or underinsured, the cost of having a test can be very worrisome. And so people forego it. And we know that screening and early detection saves lives. So having events like this where it's open to everybody and it doesn't matter if you're insured or underinsured, you can come and be screened. And should there be a finding, we have financial resources and people that are there to support you and get you through. And if you were diagnosed, plug you into the system and get you treatment quickly is so important to that patient population.
Now, the World Health Organization found that 70% of premature cancer deaths among women are preventable. What does it mean to have a premature cancer death, and how are these deaths preventable?
So preventing premature breast cancer related deaths is really done through early detection. And early detection is done through screening. So it is crucial that we provide screening for women because the earlier that we catch a breast cancer, we know that the prognosis is much, much better. And we can avoid treating patients with more aggressive treatments when the diagnosis is made earlier.
Now, the center offers surgical and reconstruction care, which you kind of mentioned earlier. What do these services consist of, and what are some misconceptions women have about these services?
So plastic and reconstructive service is part of the services that we offer, and that is for a woman that perhaps is going to need a mastectomy, so removal of the breast tissue. They can meet with a plastic surgeon, and that breast can be reconstructed either with an implant or autologous reconstruction, which is using tissue from your own body, like the abdomen, to then reconstruct a breast. And one of the biggest misconceptions that we see with patients is that they think that this is not covered by insurance because they see plastic surgery. But that's not the case. Plastic and reconstructive surgery related to breast cancer is absolutely covered by insurance, and all of the patients are entitled to see a plastic and reconstructive surgeon. The other misconception is that it has to be done immediately because for some women, it's not a decision they're ready to make at that moment. And reconstruction can be done years later, and that is still covered by insurance.
Now, when should women begin looking for signs and getting screened?
So for screening mammograms, we follow the American College of Radiology's guidelines, and that is age 40 for a woman of average risk. For women that are at higher risk, either because of family history or genetic mutation, they're screened earlier, and that's a separate guideline that we would follow for those patients. As far as looking for signs, I think it's important that women are always familiar with their breasts and their breast tissue. If a woman feels a lump in the breast, if a woman notices changes on the skin of the breast, particularly around the nipple, so like a red scaly type rash, if the woman notices discharge from the nipple that's particularly clear or bloody coming out by itself, those are all reasons that you should make an appointment with your doctor immediately to be evaluated and then be referred for the appropriate imaging.
Now, I also want to talk about, you said that sometimes based on genetic history or, based on what community you come from, screening may look a little bit different. Can you talk about the risks that Black and Hispanic women face in regards to breast cancer? Because I understand that it may be a little bit different compared to other groups.
So, as far as risk goes, the number one thing that we look for is genetic mutations, right? So, if a woman has a genetic mutation, the one that we're most familiar with is BRCA, then you're at significantly increased risk of developing a breast cancer versus the average woman. For Black and Hispanic women, we do see a higher incidence of triple negative breast cancers in those patients. But if there's no family history and there's no genetic mutation, then the risk is average. It's just the type of breast cancer that we see that can be a bit different.
And now, can you just talk about the overall research? The center will help aid in now that it's here. And of course, research is always, ongoing research is always important. Can you just talk about how that will just be strengthened due to the center?
Yes, so we are an NCI accredited cancer center, and we have a very broad portfolio of research studies that are available to all of our patients. One of the studies, as you mentioned, Black and Hispanic women, that's exciting to us is called the TMEM MRI study. So this is an MRI that's done, and what they're looking for are the doorways that open up and allow cancer cells to go into the bloodstream and then metastasize or spread elsewhere in the body, from the breast to other parts of the body. And we know that these doorways are more prevalent in Black and Hispanic women. So we're doing research to see what types of medications we could use to potentially close these doorways and prevent that spread. So this is something that's really exciting and an ongoing study that we are looking forward to see resulted.
Well, Elaine, I want to thank you so much for joining us and having this really important conversation.
Thank you so much for having me.
To learn more about this new center, please go to the website, which you can find on your screen below. Don't go away. We'll be back with more Open right after this.